Hi guys, welcome back to another video of Education channel. So this is actually surgery radiology section, veterinary surgery radiology section. So preanesthetics increase the safety margin. So how? So we have seen the sentence in many give reason type questions or explain why questions and all. So preanesthetics will be increasing the safety margin. How preanesthetics increase the safety margin? We'll be dealing with that answer in this video. So if you haven't subscribed this channel yet, feel free to subscribe and hit the bell button for more updates. So what are pre-anesthetics? Those are medications given to any patient before surgical procedure. So they are also called as pre-medicants. Pre-anesthetics are also called as pre-medicants. So we have done many videos on the pre-anesthetic sections. So I'll be giving the link in the I button. So go and watch it. So the four types of main pre-medicants used are anticholinergics, tranquilizers and neurolepts, sedatives, and opioid pain relieving agents. So you can see these things. So the aims of pre-medication, why we are using pre-medication and how they increase the safety margin. So first one is to reduce the fear and calming the patient. So patient will be very calm, all the respiratory rate and the normal physiology will be happening if the animal is calm. So to reduce the stress during restraining and minor manipulations like placement of catheters, etc. To produce pre, intra and post-operative analgesia so that the surgery will be proper and the pain relieving will be almost in normal method. To reduce salivary secretions and airway secretions. So if at all the salivary secretions are airway secretions are reduced, the air pathway will be very clear and oxygen can easily pass through the bronchi and it can easily pass to the blood and produce normal respiratory physiology. So what we need? We need a wide big lumen in case of the trachea. So we are reducing the secretions and we are reducing the salivary secretions also and airway secretions also. To decrease the total quantity or the amount of major anesthetic drug. So any anesthetic drug will be having its own side effects and other problems. So if at all we are in need of very low amount of major anesthetic means we can reduce the side effects. So that's why we are using pre-medications. So it will be reducing the deleterious side effects of major side anesthetic drug. So the deleterious side effects are the unwanted side effects of the major anesthetic drug. So if we are using very less amount of major anesthetic drug, the deleterious side effects will be very less. So next one is to provide smooth induction so that the surgery will be having a smooth beginning and smooth post-operative period. Next is to reduce intraoperative complications like vomiting and regurgitation. So there are many complications during the surgical time, that is mainly vomiting and regurgitation. So whenever this happens, it can lead to aspiratory pneumonia and that can even lead to death. So we need to prevent vomiting and regurgitation. That's why we will be giving certain types of pre-medical drugs so that there is no vomiting, no regurgitation and no salivary secretion and no airway secretion, so that all the physiologically will be very smooth. So next is to provide safe and smooth recovery. So we need to have a safe and smooth recovery after the operation. So what happens? The pre-medicants will be working very nice to provide these things. So thank you.